Welcome back to my channel, guys. So today we are going to do a midstream specimen of urine. I already have one video on my channel about this. If you want to see that, that's a bit of practice session. So if you feel like it's not accurate or there is any mistakes, please let me know. Okay, this one is only for a teaching purpose. I'm not going to do it or perform it. Okay, I'm just going to explain it to you how you are going to do in the exam. All right, so let's get started. In the midstream urine, there are important things which you need to remember is the preparation of the patient and the way you explain to the patient that how you are going to perform midstream urine. Okay, and then the timing is very important, because the strip they use here, it's different from the one we use at back home. Okay, so they check the strip for glucose at 30 seconds, so it must be at 30 seconds in the exam. Okay, and the next one is ketones at 40 seconds, so you need to make sure you do it at 40 seconds. The timing is most important. Many candidates fail because of this. Okay, so you need to make sure that you do it correctly. So we'll begin with the procedure. Okay, so pre-procedure checks, as usual, you will check for the scene safety, you will check for the hazards and patient privacy. Then you are going to perform hand hygiene and let the hands dry for 30 seconds afterwards. Then, moving on to the introduction, you are going to introduce yourself, explain the purpose of the encounter, and gain consent. You are going to check the patient ID, full name, date of birth, and hospital number, and also the allergies and the reaction to it. And then patient comfort, pain, concern, toilet needs. If they have any of these concern, you are going to attend those. Okay, after that you are going to prepare the patient, which is important. I told you earlier, this is the most important bit. Okay, you are going to discuss the whole procedure to the patient. So you are going to tell the patient, so you have to take a sample of midstream urine, and I'm going to explain the whole procedure to you. First of all, you need to clean yourself thoroughly. Okay, so before you enter when you enter the toilet, washroom, you need to wash your hands thoroughly. Okay, and then you need to part the labia, clean the urethral meatus with normal saline or non-detergent soap and water from front to back. After that, they can clean one side of the labia from top to bottom and do the same for the other side of the labia. This is just to optimize general cleansing and to minimize other organisms contaminating the specimen. And they can use a separate paper towel to wipe downwards from front to back to drying. Okay, and then they are going to perform hand hygiene afterwards, and then we are going to explain the patient. So after cleaning the area, after cleaning your hands, you can begin voiding. First stream of urine, approximately 15 to 30 ml, goes into the toilet, and then while separating the labia, place wide mouth container into the urine stream without interrupting the flow of urine, and then the remaining urine will go into the commode again. So this is very important, that first stream of urine 15 to 30 ml goes into the toilet, and then you collect the midstream urine without interrupting the flow of urine, and then the remaining urine goes into the toilet again. So this is the way we do midstream urine. Make sure you explain to the patient very clearly. So now it's your turn. You will be provided with the sample. Okay, you are going to wash your hands with soap and water or use alcohol gel. Wear apron and gloves. Place your watch onto the table, and then you will check the equipment. The reagent strip should be stored in the dark and dry place. Okay, you will check the expiry date for that, and then you are going to place your watch on the table, and then you need some paper towels. Okay, and then after taking one strip from the container, you are going to replace the cap immediately and close it tightly. Okay, then you are going to dip that strip into the urine for no longer than 1 second. Okay, and immerse the strip into the urine for immerse the strip completely into the urine and remove immediately. You can run edges of the strip along the container to remove excess urine and prevent mixing of the chemicals from adjacent reagent areas. Okay, and then the most important thing is you need to hold the stick at an angle, because what happen is a urine reagent strip should not be held upright, because urine can run from square to square, it can mix various reagents. So make sure you don't do that. Hold it at an angle. Never ever hold it ups and down. Okay, after that you can place the reagent strip onto the paper towel and wait the required time before reading the test strip. Test strip as I said earlier. So glucose is read at 30 seconds. You will wait for 30 seconds and then say that I have 30 seconds are over and I will check for the glucose. Then following on ketones at 40 seconds, and then there is the rest of the things at 45 seconds, and there are four things at 60 seconds. You are going to do at 60 seconds exactly, and then you are going to remove your gloves, perform hand hygiene and write the readings whatever you have got. After taking the reading, you are going to explain to the patient the results. If they have got any sugar there in the urine, you are going to explain them about their diet. And if they have got ketones, this is an emergency, right? For the ketones, they need an immediate treatment. Maybe their blood sugar is out of control, or if they are diabetic, their blood sugar may be out of control, that's why they are having ketones. Okay, and if they have protein, they need to make sure that they don't eat food high in proteins. Okay, and if there is leukocyte, means they have infection. So make sure that you explain the patient, health educate the patient according to the results. And then it's always good to drink plenty of water, of course. And then you can perform hand hygiene, dispose of urine sample into the sluice or toilet, and you can discard the things which you have used. Okay, and we always discard the urine into the sluice to prevent environmental contamination. Okay, you are going to tell the patient that I'm going to inform the results to the doctor, and he can explain you further whether he needs to change the medication, or if he want me to send the sample to the lab, we will do that. All right, and you can clean your hands with soap and water or alcohol hand rub. Thank the patient and finish the procedure. That's it. Before you leave, again, you need to make sure your patient is safe, comfortable, side rails are appropriate. If they need water or something, give them a call bell, and they can ring the buzzer if they need you. Okay, so that's it for the midstream urine. As I said earlier, preparation of the patient and the timing is important in this section. So I hope this video was helpful for you, and keep sharing my videos with your friends who are preparing for the Osce exam. And don't forget to subscribe, share, like and comment in the section below. Thank you so much. Have a good day. God bless you and take care.